this video, I will be talking about the benefits and risks of getting screened for breast cancer. Getting screened regularly can help find breast cancer before a lump can be felt by hand. This image shows the average size of lumps by the method of detection. It shows here that the average size of a lump found through regular mammogram screening is 1.1 centimeters. However, the mammogram has the ability to detect even smaller masses that cannot be felt at all. This degree of early detection means that the cancer has less time to spread, so it could lead to a lower chance of dying from breast cancer. Detecting cancer through a screening mammogram does not guarantee that the cancer will be cured, but it may help with the odds of survival. This graph shows the 5-year survival rate in percentages with the stages of when the cancer was diagnosed. We can clearly see that the survival rates are better when the cancer is detected in the early stages, with the highest 5-year survival rate at stage 1 in blue, which is close to 100%. Other benefits include a better outcome with treatment and fewer and less invasive treatments. In a medical context, the term invasive refers to anything that enters the body in a physical way, usually by breaking the skin or entering through a natural opening. A less invasive treatment could mean making a smaller cut during surgery or limiting the area involved, thereby lowering the risk and shortening the recovery time. In the context of breast cancer treatment, an example of a less invasive treatment is a lumpectomy, which removes only the specific area of the breast containing the lump, rather than a mastectomy, which removes the entire breast. Finding breast cancer early can make less invasive treatment options possible. In terms of the potential harms of screening, sometimes a healthy individual undergoing a screening mammogram can get an abnormal result even though they do not have breast cancer. This is called a false positive result. False positive results can lead to additional imaging tests or a biopsy, with the final result of these tests showing that there is no breast cancer. In most cases, the only additional test required would be a diagnostic mammogram, which takes additional views of a specific area of interest. Sometimes the additional test required is a breast ultrasound or a breast MRI. When a breast biopsy is needed, a sample of the abnormal area is taken out to check for cancer. There are many different ways of getting the sample, but most commonly it is taken out with a hollow needle under local anesthesia. False positive results occur more commonly if it is the first mammogram and there are no previous mammograms for comparison. Being called for these additional tests may be anxiety-provoking for some, but one thing to note is that if someone was called back for additional views after the first mammogram, it is less likely to happen again on the next mammogram since there is a previous mammogram to compare it to. False positives also occur more in individuals who are taking estrogen, are of younger age, have high breast densities, have had breast biopsies in the past, or have a family history of breast cancer. Screening mammograms can sometimes miss breast cancer, which can lead to someone getting a normal result even though breast cancer is present. This can cause a false sense of security in the person being tested and cause them to believe that they're healthy when they in fact have breast cancer. So if you have breast cancer symptoms, it is important to see your family doctor even if you had a normal mammogram recently, so that they can then order more specific tests for your symptoms. Overdiagnosis is when a screening mammogram finds breast cancer that would have grown too slowly to spread and the patient would not have died from it if left untreated. However, these cancers cannot be distinguished from those that are deadly, so doctors would not risk leaving them untreated. In these circumstances, these patients may be exposed to the negative side effects of cancer treatment that may not have been needed in the first place. This also brings up the important topic of discussing with the doctor the question about continuing breast cancer screening if the individual considering screening is already suffering from a life-threatening health problem. Detecting breast cancer early may not necessarily increase the life expectancy or improve their quality of life if they're already very sick. In these individuals, it may be that they would pass away with breast cancer and not from it, limiting the test's usefulness. Mammograms use X-rays, so it exposes the breasts to a low dose of radiation. People are often concerned about radiation exposure due to fears that it will increase the long-term risk of cancer. However, to get a better idea of the degree of radiation exposure someone is exposed to with one screening 2D mammogram, it is helpful to have some context. Canadians are exposed to an average of about 1.8 millisieverts per year from natural surroundings. Some example sources of this background radiation is cosmic radiation, terrestrial radiation, and radon exposure. There's even tiny amounts of radiation in the foods we eat. The total dose for a typical screening 2D mammogram with 2 views of each breast is about 0.4 millisieverts. This means that the dose of radiation from a screening mammogram is about the same as one would get from natural surroundings in Canada over about 12 weeks. Another way to look at it is, a 10-hour flight has similar radiation exposure to 1 chest x-ray, and a mammogram is around the same as 4 chest x-rays, so it's like taking a 10-hour flight 4 times. Now that you know about the benefits and risks of getting a screening mammogram, you might be curious to know how many lives are saved from breast cancer through screening, or how often these cases of overdiagnosis or false positives occur. This chart gives us an estimate based on modeling using US data to predict the approximate numbers. The chart based on current Canadian data is not yet available. As you can see in this infographic, the benefits and risks can be different depending on when you start screening. If we take, for instance, 2 groups of 1,000 women and one group starts screening regularly at age 40 and the other group starts at age 50, up to 9 lives from that group of 1,000 will be saved from breast cancer if screening is started at 40 years old, which is 2 more lives saved in every 1,000 women screened compared to the group starting at 50 years old. Overdiagnosis may occur in 12 women for the group starting at 40, while there are 10 in the group starting at 50 years old. There would be up to 200 unnecessary biopsies in the group starting at 40 years old, which is 50 more compared to the group starting at 50 years old. It is important to remember that these numbers are not referring to the results of a screening mammogram done once at 40 years old. It is estimating the total number of biopsies if these individuals started screening at 40 and continued to get screened up to 75 years of age. The great majority of the people in both groups will not experience any harms from breast cancer screening, as indicated by the blue circles. If you would like personalized assistance that incorporates your values and preferences to help you decide whether to undergo screening now or to defer screening, please see your primary care provider. If at the end you decide not to start screening now, you can always change your mind at any time. If you already made the decision to get screened, click on the link in the video's description to your region's breast cancer screening program to find out more about how to book your mammogram. For people who have already made the decision to undergo screening, I'm going to provide some tips to help you prepare for your mammogram. Try to go to the same imaging center as before if you had a mammogram in the past. This will reduce your chance of getting a false positive, as the radiologist will have access to the previously taken mammogram pictures for comparison. If you're unable to return to the same center, try to bring the images or have the imaging sent from the previous imaging center to your current one. If possible, try to schedule your test for when your breasts aren't likely to be tender or swollen. The week before the menstrual period is usually the most uncomfortable for most people. On the day of the exam, don't apply deodorant, antiperspirant, powders, or creams on your armpits or on your breasts because they can show up on the images as white spots. Wear a 2-piece outfit like a skirt or pants so that you'll only need to remove your bra and your top for the test. Please let the technologist know if you have breast implants or have a history of breast surgery. Also, let the technologist know if you're pregnant or breastfeeding. If you found this video to be helpful to you, please like this video and subscribe to the channel to receive updates on new videos.